Welcome to the Boom Room Unfiltered. I'm here with a close friend of ours, Dr. Gene Levinstein, a friend, a neighbor, a client. We're excited to have you here today. We're also here with Loretta Stark. Dr. Levinstein, thanks for coming today.
Hey, buddy. My pleasure.
We've been trying to do this for a couple months now. And so I'm happy that you made an appearance. I know your schedule is very tight. So thank you for coming out from Allentown, right?
That's right.
So your main practice is in Allentown, PA.
Correct. That's where we have the main office at Allentown and Bethlehem, but we have a multi-state presence. I'm licensed in multi-states, and we're trying to establish essentially a national presence for my main practice, Regen Doctors.
Amazing. So let's backtrack a bit. So you are a physician. When did you get into medicine? How did you get into medicine? How does your whole story begin when you came?
Take us back to the beginning.
Take us back to the beginning of little Gene.
Little bitty. Yeah. All right. So Ukrainian immigrant, growing up in Kiev, facing what do I do when you finish Ukrainian version of high school? I had either choice to continue with a version of high school or go to nursing school. Okay. So got accepted to nursing school, finished first year. Honestly, it was a no-brainer. 15 years old, 30 ladies in my class, 3 guys, right? Okay.
He's like the Russian Gaylord Fokker.
That's right. Love it. Perfect. I love that analogy.
Fuck her out. Okay.
Fuck her out. Afterwards, thanks to my parents, they got a visa finally to come to the States. So standard immigrant route.
This is what year?
88.
My favorite year.
Good year.
88. Good
year.
Yeah,
so we can start tracking my age slowly. My birthday's coming up pretty soon.
Okay.
Came here, got stuck back in high school. Went to glorious Northeast High. Followed by Temple undergrad. Med school, back to Temple for residency. Did my residency at Temple, physical medicine and rehab. Followed by pain management. Okay. So
that's your main claim to fame. That's your
that was my main training. And standard immigrant route. Got a job in America, third day. Came here. That's what you just brought back memories. Coming here wearing a pair of Bobo sneakers, going to high school. Right. That's not gonna work. Right. So got a job, washed scrubbing ovens in a Greek restaurant in Castor Ave. $3 an hour cash, and bought a pair of used Reeboks at a Roosevelt Mall flea market. That was my first purchase in the United States.
So you appreciate it now, right?
I appreciate it.
That's it, man. That's where you came from and where you are today. So when you got out of med school, you went for residency. You finished Temple residency,
physical medicine and rehab.
Right. Okay. And then where did you go off to then?
So I did fellowship subspecialty training in pain management. I knew I didn't want to be general physical medicine and rehab, even though it's a specialty.
That was my question. So you wanted to get into pain management. That was your...
I did. It's an immediate gratification. When you ask any patient, besides cancer and death, what do you don't you want to do? I don't want to be in pain, right? That's pretty uniform. No matter what the condition is, I don't want to be in pain. Is it going to hurt?
That makes sense.
And it's a fun specialty because you get to work with your hands. It's primarily interventional. So you get to do a lot of things. For me, I think I have a little bit of ADHD, probably short attention span. So I like quick.
Right.
And
quick results.
And I'm pretty good with my hands, except don't ask my wife. I can't hang those, anything at the house.
Don't get me started.
I'm not going to be able to get it straight. It's going to be crooked. And I'll tell her, no, it's straight.
What are we talking about? Are we talking about the house or what are we talking about?
Well, complaining about the wife.
Okay.
It's cool. You call you guys the Hebrew Hammers.
We are the Hebrew Hammers, yeah. That's what we're lack of. So you wanted to get into pain management. You had a liking for it. And instant gratification, but so you didn't want to work in a hospital. You already knew you wanted to have your own practice. That was the key, right?
Yeah, I wanted to have my own practice, wanted to work with different types of patients. Cannot stand hospital work. I used to do in the beginning, did some hospital consults.
So you were in the hospital at one point or not at all?
Don't you have to do that as part of your
residency?
Well, we do that as part of residency.
Because you have to
rotations. Right. So you do some basic rotations as part of medical school where you rotate through your core sciences and your electives. Okay. Right. So that's where you get to pick your specialty. What do you want to do? What interests you? What turns you on? What do you love? And then after your residency training, that's when you become a specialist. Right. When you get out of med school, you're really jack of all trades, a master of none. You are
internal medicine. It's
not even internal. No, you're not internal medicine.
You're just in the general.
You just have an MD or DO. That's it. You're not allowed to practice medicine.
Okay.
state of PA Commonwealth does not allow you to practice medicine.
So you do your specialty.
Until you do your residency, whether it's internal medicine. Don't put GPs or family medicine docs down. They still have to go through residency.
Right.
Okay.
Okay.
And once you did all that,
that's when you go for additional subspecialty training.
And that was the pain management
correct
specialty.
So
Understood.
If you want to count the years, undergrad 4, med school 4, internship, residency 4, and then 5. So that's 107, I think.
So once you finish all of those years of education and continuing education and the fellowship, you decided that I wanted to open up shop.
Correct.
Okay, so you chose, it's called Regents?
Well, originally my practice was named PA, Pennsylvania Pain Specialists. So there's obviously a story.
Where did you get the name Regen?
So Regen stands for Regenerative.
Regenerative.
Yeah, Regen Doctors. That's brand new. So I'll explain. Originally, I trained in pain, and this was back. I finished residency in like 2004, 2005.
Okay.
My first job I was offered with a large orthopedic group up in Bethlehem, Allentown. That's how I ended up there.
That makes sense. Okay.
And during our training, we were taught that pain is a 5th vital sign. Your respiration, your blood pressure, blah, 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 and pain is a 5th vital sign. So this is, we're going towards the height of the opioid epidemic, right?
Yeah.
And where you come out as a pain doctor, I know how to do procedures.
Right.
I know I'm taught for 1 year how to do spinal injections, how to do joint injections, how to do Botox, how to do everything else that involves the needle, maybe small incisions, high-level procedures. But even in fellowship, nobody really teaches you how to prescribe medications. And we have these drug reps coming out and pushing drugs. Pain is a 5th vital sign. Make sure the patients are well covered. And that's what we did. So being, my practice was appropriately named Pennsylvania Pain Specialists. And that's what I did for a number of years. I also worked with a number of big pharma companies, teaching physicians how to write medications more, I would say, that would be appropriate and responsible.
More responsible. I was just going to say.
And exactly, responsible, because there were a number of people out there just giving them out, the pill mills. We're not even talking about Florida.
I just watched those 2 documentaries. I'm sure you watched them, but yeah, like how it was back in the 80s and 90s, how they...
What, the opioid
dispensing,
crisis?
yeah.
So those docs are 100% on the money. And some of the physicians mentioned in those docs who were teaching us how to do things, they were actually the ones out there pushing us on behalf of the pharma companies. Because I met those physicians, and they were presented to us as these gurus who came down from the clouds to teach us mere mortals how to do things. So I only work with the big pharma companies that developed abuse-deterrent formulations.
Okay,
Abuse-deterrent
that's good.
It's harder to crush, snort, divert in any way, shape, or form.
Other than orally.
But that's only, there's 2 types of pain meds. There's extended release that typically lasts anywhere from 12 to 24 hours, and immediate release.
Right.
Which are the pills?
Which is just the oxys, perks, and whatever you want to call it.
Right.
And those are very difficult to develop abuse-deterrent formulation because they're immediate release. Right. They have to be released immediately. Anytime you develop you envelop and just put a cloak around it of any chemicals that makes it more difficult to separate, you break that immediate release, right? So that's why it wasn't coming up.
Okay.
That's why so much abuse specifically in oxycodone and the Percocet family. So I actually work with a small pharmaceutical company out of Allentown. They're in Genus Sciences. We developed a formulation to prevent abuse and overdose. First of its kind.
How does that work?
Well, that's a whole different podcast.
I'm fascinated because how does that... Yeah, I love rabbit holes.
Yeah, so unfortunately, it never took... so it works by slowing down the absorption. The medication absorbs through the gastric system, but then no matter the more pills you take, the more they clump up together. And they just go through your gut as a big clump.
Okay.
And by the time they come out the other end, didn't absorb enough to OD.
So they don't disintegrate.
Oh, okay.
They don't disintegrate. They kind of clump up together. So it prevents primarily, the point was to prevent overdose.
Okay.
Whether it's intentional or unintentional.
Okay.
So we designed the trial. I know we're all animal lovers here. For some doggies, cost us about $1 million. We did that in Canada and got half decent results. But then we were knocking on the door in every big pharma company. Hey, we have this data. No, thank you. no, thank you. No, thank you. And unfortunately, our project just died kind of halfway because we were not big pharma. We could not afford
to compete
and enough clinical. It cost us over $1 million to do the overdose trial on doggies, right? Because you have to have resuscitation equipment. You have to dose appropriately. It costs probably over $100,000 or close to it per animal. So to design it on humans is obviously so much more.
Right.
And we just couldn't get past that point. So I think I was trying to answer your question. Why Pennsylvania? Why Regen? So at some point, I realized that I'm out here treating these folks who want pills, who want opioids, and or steroid injections, because that's what primarily what we do. Like, let's say when we're talking about injections, everybody thinks epidurals. Pain management is so much more than just epidurals. There's so many more different procedures, but let's just take a simple epidural, which is a steroid injection. And there's nothing wrong with it. It's a staple of pain management. Mm-hmm. It works. It takes down inflammation. It's not the same steroid, Joe, that you're thinking of.
No, I know. But it's temporary.
It is temporary.
Okay.
It's not a fix.
Right.
It's a Band-Aid.
So if I have an issue with my shoulder, and every so often I get you gave me the shot, actually.
I did.
What is that shot?
Steroid.
That's a steroid
shot. That was a steroid
But it's
shot.
Also called a...
Depo-Medrol. It was just it's a steroid shot.
Okay, so that's exactly what you're referring to. Okay.
And was he a baby? I just have to ask, was he a baby about it? Because he's
oh my God,
he's a baby.
My daughter had to hold his hand. And stroke his other shoulder, so he does not pass out.
I couldn't pick up my arm. I was in that kind of pain, but it happens every 3-4 years. So I think I'm doing about a year or so. I'll be in touch.
Well, there you go.
So that's what you're referring to in regard to the pain management.
Yes.
People have a distorted view of what they think pain management is. There's so many different facets of it.
Correct.
Okay.
But also what I was doing, I realized that I'm treating these folks with injections that are temporary. I'm playing a whack-a-mole game, right? I plug this hole, Loretta, Band-Aid here, pops out there. And these patients are unhealthy. They're obese. They're not just, their hormones are out of whack. They're not following anything. And, product of being typical allopathic or osteopathic American education, you come in with the medication A, you have a side effect of medication A, here's a medication B.
Right,
you have a side effect
to
of
offset the
side, and then there's a medication C. And before you know it,
now
you
you're taking 30 pills.
Going.
Yeah. It's like when I see those antidepressants or whatever, and if your antidepressant isn't working that great, take this along with your antidepressant. And I'm just like, well, what the hell?
Well, it's all trial and error. That's what it is.
Well, for patients, it is trial and error, but unfortunately, medications do have side effects, as most things in the world.
Well, it doesn't have a side effect, yeah. Where is your project now?
So that's where Regen Doctors was born.
Okay.
I wanted to kind of almost not divert, but diversify or change direction of my practice to offer more holistic approach.
Okay.
And when I'm saying holistic approach, it's not, I'm still doing the core of my pain management.
Right.
I still have patients who need pain medications.
Right.
I still have patients who get the same steroid injections. But I wanted to offer them something more novel, something different, something that's going to prolong life. One of the conferences years ago, I met some fascinating people pre-COVID going where we're actually able to go to conferences, and it's opening up more and more these days. The world is finally normalizing, and I got interested in anti-aging. And that became my personal hobby. It's not just about looking good, feeling good, but it's also about not just about longevity, but healthgevity. What's the point to living to 90 when you're laying down
if you're
in the nursing home and you can't lift an arm?
So that's where I guess we get into the conversation about peptides and semaglutide, right? Semaglutide.
Well, that's, I guess, to look good.
That's to look good, obviously.
Well, no, because you don't want to be overweight and unhealthy either, right?
So both. So semaglutide can be two things, right? Depends how you look at it, depending on which camp you belong. Some say it's a great God's
that to me is the whole entire where I'm confused, because I ask you this all the time when we're for dinner talking. Like, I don't understand the difference between the two. So that's if you can kind of
semaglutide and tirzepatide or Wegovy, Mounjaro.
All of the above. Yeah, let's go through the motions, because I think everybody would like to know, because I have no idea.
And it's a hot topic.
It is a hot topic.
It is a hot topic. Yeah. It's a great topic. So, number of things. Couple, if you ask two different physicians, what do you think? And you know what they say about opinions, right? What is semaglutide, which is essentially the generic form, which is no generic, but that's the active compound in Ozempic, and tirzepatide is the active compound in Mounjaro.
Okay.
is it the greatest thing or worst thing? And you will get two different answers.
Right. You're always going to have.
Well, it depends for who. For people that are obese and they have a weight issue.
But it's not that simple, right? Even if you're obese and you are obese diabetic, right? There's appropriate candidates. So let's go what those medications are. And I'm going to focus first on semaglutide. Semaglutide is something called GLP-1 receptor agonist.
Okay.
Glucagon, something receptor peptide. I just blanked out what it stands for.
I have it in my notes.
Oh, thank you.
Read it, Joey.
Read it to us.
I have the GLP-1 agonist semaglutide and tirzepatide for weight loss and decreased cravings.
That's my
Close, Joe, but no cigar.
No, okay.
Your notes need to be updated, but we'll do it next time.
Okay.
So it works by a couple different mechanisms, right? It works by slowing down how fast the food empties out of your stomach, right?
And that's what keeps you not hungry.
Makes you feel full faster. So portion control, right? In America, we belong to Clean Plate Club. Also, I think versus Europe, that's what I think what separates us from the rest of the world. Our portions are a bit more robust, right? So it works on that, makes you feel full faster. Number two, by affecting those GLP-1 receptors, it improves your insulin sensitivity. And what we see in our patients, and we've seen it more recently, whether it's the chemicals in the food or whatever it is, we become insulin insensitive. Meaning you're not a diabetic, right? But you're still not responding the same way to sugars that you eat as you would. So we also see more fatty livers in completely healthy individuals. They're not drinkers, they're not bitch drinkers, but we see more cases of fatty livers. And there's no rhyme or reason for it. Whether it's, some say it's chemicals in the food, it's gluten.
I always think it's chemicals in the food.
I would think it's chemicals in the food too.
And
what do you think?
I think it's chemicals and preservatives in the food.
Yeah, the preservatives and chemicals and everything they treat the
meats with. Because if you just said you do testing, I mean, I'm sure you've done studies on individuals live in Europe versus individuals live here in the States. I'm sure it's two different lifestyles, two different diets,
Well, so there was actually, besides genetics, right? And in America, we have such a blend of population. I mean, it's hard to, you can trace it.
Yeah, you can't zero it in, Right,
you can't zero in a specific group. But diet and preservatives, there was a recent study in Japan, I think in smokers and drinkers. And apparently Japan I think the group that they used was young male professionals. And Loretta, we'll go down that rabbit hole. Apparently the amount of drinking and smoking in the young male professionals in Japan is absolutely crazy.
Really?
You wouldn't think, right?
No.
They beat Russia, they beat China. But their longevity is off the chart. And the only thing that differs, besides obviously some Japanese, I think that they have certain clusters where people live to 110 and 120.
The blue zones,
It's the freshness of the food and amount of, sushi that you get, which is obviously super fresh, not the stuff that we get on, certain Northeast joints.
On Boostleton.
Well,
exactly.
On the Boostleton, yes. But obviously, Mediterranean diet.
Correct.
Okay, so that maybe not so much the Mediterranean diet, but obviously fresh fish and non-preservative, whatever, the foods that have no preservatives are going to be definitely a huge, reason behind why they're living such a healthy lifestyle.
It is. But in the States, unfortunately,
everything's got
everything got preservatives, right? And not all of us can afford it or have access to it,
right?
Especially patients in low income
households.
Areas, even in Philly.
It's cheaper to eat McDonald's than it is to go buy a head of broccoli.
You're correct.
Miss McDonald.
Listen. And then, I do love McDonald's.
Yes,
and then you've got like the whole Monsanto factor.
Well, true. Yeah.
On their fresh vegetables and everything. And so, that's probably why everybody's more obese here. Or more diabetic, more prone to being
pre-diabetic.
I have a diabetic sister. She's been insulin dependent, I think, since she was 16.
And there's nothing wrong with insulin, right? Insulin helps. But we were talking about specifically these patients who are not diabetics.
Right.
But they're prone to have this insulin resistance.
Insulin resistant.
And others. So we were talking before we're going down these tangents.
Right.
So getting back to semaglutide.
Right.
So it affects these GLP-1 receptors, which will help you lose fat, which will help you lose weight, right? Those receptors are located in your fat. They're also located in your muscle. And specifically, they're located on your muscle. So that's incredibly important. So when you take another way that it works, it affects one of the brain pathways, it decreases cravings. So whether cravings are sweets or salty or, crunchies, it decreases those cravings.
You don't have them anymore.
So, right, you know how that works.
Yeah, I love semaglutide. Well, okay, so here's the story. I'm not a naturally thin person, but I'm not an obese person either. And I think mine was hormonal because I had hit postmenopause. And it's like you woke up one day and you were puffy. You can work out, you can live on lettuce and lemon water, and you either stay puffy or actually you get puffier. And you're like, what can I do? Nothing's working. What worked, after you had kids and you can lose your weight, or what worked in your 20s, nothing was working. So I went on, I went on the Mounjaro, which was and
there's that.
Yeah, it just flew off me. But the most important thing was, and where I lacked, and I had to put myself, I had to eat more protein because it did start eating away some of my muscle mass.
So Loretta, I think, hold on, Joe, I'm sorry. Loretta, I think you can take my place. And you can pretty much, because you're going exactly where I was going, talking about those receptors sitting on a muscle.
Yes.
Because any physician that prescribes these medications and does not talk to patients about proper diet and exercise is a fool and is doing actually disservice to the patients.
Well, I was getting to I see that the women, I think women, I haven't seen too many men that have been on this Mounjaro. You can tell when they're on it that are not eating enough protein. You see they're all they're all dried out, and you can see everything. They don't look healthy. And I'll tell you one thing. Initially, when you were doing it, I kind of knew because you looked like you were uber thin. And I think you obviously...
Well, because I was so uber puffy.
Well,
I mean, it was like night and day.
You started eating more proteins, I would imagine.
Yes, I did. Totally because my doctor was very responsible, and I'd had to go every week and go on that machine. Mm-hmm. And I was okay. And then for some reason, the third time I went, my muscle mass decreased. And he looked at me, he goes, if that number's not up, next time you come in here, you're done.
Yep.
And he was serious.
Well, makes sense.
I went home and I
chowed down.
I chowed down on protein, and now I'm trying to incorporate it more. So I keep my muscle mass, but it is very important. And if you do have a doctor that isn't responsible, that's when you start looking like the other way around.
But yeah, you heard the term, they coined Ozempic face.
Yeah.
Oh, yeah.
Right. So that's
I do have Ozempic ass. Can you help me with that after the show?
Absolutely.
I paid Dr. Shafran $2,000 for my ass, and then now it's gone. But if you can help me with that would, thank you. Thank you, Doctor.
I will talk about another product that can possibly fix your ass.
Okay. Yes.
In the next 20 minutes.
Okay. We'll talk about that.
Yes.
So,
yes.
But getting back to this, so this product works by so many different ways, right?
Yes.
But you have to be responsible. Sometimes some patients really lose the desire to eat. The side effects are typically minimal. Mm-hmm. Because it affects mainly the GI system. Most of the side effects, if you were to experience any, would be GI related, mm-hmm. right? Nausea, maybe constipation. Some patients even get diarrhea. Some patients may get a sulfur burps because the food stays in too long. But 99% of patients are able to have, tolerate it really well. And the ability to use a compounded semaglutide for patients who are not able to get it. Like, for example, I have an overweight diabetic as my patient. Great health insurance, not on formulary. So we're able to offer this patient compounded medication. Mm-hmm. It is out of pocket, but it is what it is. And patient is able to get their hemoglobin A1C, their sugars under control, their diet under control, they're losing weight. And we're actually able to work with their primary doc to get them some of the diabetic medications.
Helps with their high blood pressure. I mean,
it lowers everything. But you have to, like you said, you have to take enough protein. And the proper protein intake is about 1 gram per pound body weight or goal body weight. So if you're 160 pounds mm-hmm. and your goal is, let's say, 130 pounds, you need to consume at least 130 grams of protein. And it's per day.
That's a lot.
It's a lot.
Yeah, I can tell you I don't hit that target.
I need to eat, if I'm right now 206, 207, I need to eat 200 pounds a day?
That's a lot. Who can
200 grams of protein per day, Joe. And I've seen you work out. You work out hard.
When he doesn't fall off the box.
When he's not on the phone.
And he's not on the phone.
That's right.
Yeah, he did. We have video we can show you. He fell off the box when he was doing boxing.
Tony's a long time ago.
200, like I don't know if I can tell you that.
How can I eat 200 grams of protein a day? You eat 200?
You're going to have to drink eggs and stuff like that.
You're 160 pounds?
Almost, yeah.
Okay,
so what do you eat during the day? Are you making your Protein?
So, yes, I make the protein.
Are you drinking eggs or something? You have
Well,
to
I
be
eat eggs. I just eat egg whites. My poor spouse boils me about 5 or 6 egg whites every morning before I leave for the gym.
Okay.
And I get fresh egg whites every morning, followed by yogurt and cottage cheese. And I add protein powder to my yogurts and cottage cheese, and I mix it in.
Okay.
And I call it making my own yogurt. Obviously, I'm not.
Okay.
So that's around 30 grams in the morning.
Right. I make a shake.
Okay. So
Which has another 25, 35 grams. And the shakes are pretty much just the greens. A kale, spinach, chard, bunch of plain Greek yogurt, some beet powder, moringa powder to decrease the sugar spike, which is great, and protein. That's it. Nothing else. No sugar, no bananas, no fruits. It's not necessary.
So you don't eat a lot of fruits?
I have a fruit craving, and I do snack on some fruits like a pear, banana.
No, because I eat a lot of fruits.
I like fruit. If fruit helps you go to the bathroom. You gotta go to the bathroom. You can't.
So
I trade a lot of fruit a day.
Prunes, yeah.
3 prunes a day, baby.
That's no, but I like fruits.
I think we're learning way too much about my diet habits.
I'm telling you,
my prune habits.
Well, I understand something. So you're having what, 40, 50 grams of protein before you even have lunch.
He didn't even go to work yet.
You didn't go to work yet. You had 40.
I'm probably cutting it down on the way to work.
Yeah, he's not even in the office yet, and he's.
And lunch is the same: drinkable protein, and then early dinner.
When you walked in, I remember I'm going to get this ready stuff. This ready has protein too, right?
Correct. So again, we talked about preservatives, right? And unfortunately, I don't always practice what I preach.
I was thinking it doesn't have preservative. You can't get away from it.
You cannot compete.
You can't get away from it.
So there's certain brands I will drink protein. I will drink protein drinks that have, I think it's about 200 some calories, 40 grams protein, like 1 or 2 grams of sugar, or drink these protein waters which have 20 grams of protein. Without these supplements,
you can't make
personally, I have a job, right? You run around.
Yeah.
You cannot consume that much protein.
No.
Even if you have huge chunks of salmon for dinner and, your root veggies. And it's always recommended, actually, patients who are on semaglutide or tirzepatide to start your dinner with protein before you get full.
Eat the protein first and then eat the vegetables.
Or put it in your salad. If you're going to do it that way, big bowl of salad, take your salmon, take your chicken, whatever protein you're using, red meat. If you're, this is not a diet peptide. A podcast. I'm not a nutritionist.
Right.
Dump it right in your salad.
Before he gets tired, I want to get on how to build the muscle because I know he builds muscle too.
I see him at the gym. I mean, he goes to the gym every day.
I know, but that's
a good question. So you're saying that this
semaglutide,
this Ozempic, whatever you want to call it, it affects the midsection and the muscles.
Well, everywhere.
It will affect those. You will start losing fat, right? So the beauty of drug like semaglutide and tirzepatide, and the main difference, let's quickly cover the two. Right. Semaglutide affects just the GLP-1 receptors. Tirzepatide affects
what are those
two types of receptors.
Those receptors, what are they?
They work on your insulin sensitivity.
And your what sensitivity?
Insulin sensitivity.
Insulin sensitivity, okay.
They help you metabolize your sugars.
A lot faster.
And they help you burn the fats.
A lot faster.
Right?
Okay.
A lot faster, a lot more efficiently.
Okay.
So tirzepatide, it's a lot more expensive.
Okay.
And supposed to be much better tolerated, a lot less side effects, and like you said, the weight just melts off.
And you should not take them hand in hand. It's one or the other.
I wouldn't take them. It's one or the other. Holy cow.
Okay.
Yeah, it would be a bit much to mix them together.
That's like taking heroin and fentanyl.
Okay.
Like at the same time.
So that's like Kensington LA.
So question for you. So you take the semaglutide. How, other than taking protein, enough protein that's going to offset the amount of
muscle
potential loss.
Yeah,
yes.
So you can eat all that, but then also have to work out.
You have to work out.
You have to. There's no way of not working out.
So it's very easy to sit on the pedestal, right? I'm the mighty doctor wearing my white coat. You gotta work out.
Right.
I'm Zeus talking down to the mere mortals. It doesn't work like that. A lot of folks, they haven't worked out in years. I'll tell you, we're trying to have pretty much national presence. And every patient, not every patient, 90% of patients who I talk to, I ask the same questions, and I probably know the answers already. Do you work out? I'm about to start, or I walk a lot. How's your diet? It's not great, but I'm working on it. Right? So
sounds like me.
And I understand the mentality of it, right? When you get to the gym and you are the biggest person there, or you get run out of breath in 10 minutes, and you see all other 20-year-olds pump and iron, mentally it's tough.
Yeah, of course.
So when I work with our patients, this is a kick in the ass. This is a start. But if we make a deal that they will get there, listen, there's stacks. I hate to use the word stack because that's a bodybuilding word, and traditionally they were usually gray market products. But you should be using a stack, whether it's boatload of protein or other things. But I try to make my patients make a deal with them that they have to work out.
So give me a day in the life, not of your life, but you get to your office and you met your first patient. And you how many patients do you see a day?
You don't want to know. So my day starts...
30?
30 plus. My day starts before I get to my office. When I'm driving to the office, I'm already on the phone with patients. I'm doing follow-ups. I'm not texting and driving.
Okay.
I'm just talking on the phone. I'm using Siri.
Okay.
So no tickets. Thank God for my FOP cards.
FOB or FOP?
FOP.
Okay. But my question to you is this. You pretty much everybody that you see has the same type of dilemma. For the most part.
Yeah, I would think so. Or
traditionally, we have patients coming in, with pain, and then we try to work on losing weight, get off the traditional medications. And again, opioid use decreases testosterone. So we got to look at their hormones. Loretta mentioned you were going through menopause, right?
I'm
perimenopause.
I'm a science project. I can't. So at 37, I had a full hysterectomy. Full. So I've been in menopause since I woke up from that surgery.
So you had surgically induced early menopause.
Yes, but it screwed me up because I believe that I went, it catapults you straight into menopause. And then I think chronologically, the rest of me caught up because I already went through the hot flashes and stuff. And now in my later life, in my 50s, I started gaining the weight, with the little women stuff downstairs, and it's like there's no cure. If you have a cure, I'll be in Allentown tomorrow morning, cancel your first patient.
We can do it right here.
Yeah. Oh, well, I don't want to take my pants off.
Listen, the people want to know.
But
for science,
it's bad. And I feel like nobody knows what to do with us. Your gynecologist doesn't want to see you anymore because he doesn't know what to do with you. He has no purpose for you. You're not having babies anymore. They don't know how to fix you. So if you have, if you have something like that, there's a lot of viewers and a lot of clients that we talk about this all the time. Where can we go? Who can fix us?
So this is about hormonal therapy for perimenopausal and postmenopausal women. So this is a little bit different than the weight loss drugs, right? Okay. When you're doing semaglutide, Peptide, they will help you lose weight. They will also work on PCOS, polycystic ovarian syndrome.
Yes.
Right, which is fantastic at a much higher doses. Those are the two products, right? But now let's switch gears. We're talking about hormonal replacement. So when I see my patients, whether it's men or perimenopausal or postmenopausal women who have difficulty losing weight, or men who are just not feeling the same, we're talking about hormones, right? And we first noticed that when patients who are in long-term opioid therapy, they brings their testosterone levels down. So you heard of the word andropause? No. So
yes.
It's I think Loretta's a
maybe the smart one should sit in the middle. I'm not sure.
Say, you guys should switch seats.
Well, you have more experience in this, obviously, Mr.
Well, I don't take testosterone.
Well, I mean, I don't either, but maybe I should.
I should though. I know I'm low on everything, but go ahead. So
men go through andropause, means their testosterone starts getting lower, and everyone is different. And this age, I mean, honestly, with whether it's chemicals or preservatives, we see this in very young men. And the range for testosterone is huge.
Yeah. When
you look at your lab work, and testosterone is a little bit different than your cholesterol, right? For testosterone, let's say typical LabCorp Quest goes from 250 to 1,000, 1,100. I guarantee you, if your testosterone is in a 250, 300, you're technically normal. You're in lower level 350, but you're not going to feel the same. And for men, it's not just, everybody thinks that testosterone is what? What's the first thing that comes to mind when you think of testosterone? Sex drive. Right. Everybody thinks it's your erection quality, it's your sex drive.
It's your energy.
Correct. So she keeps proving the point that she should be sitting in the middle of the next podcast. But for men, it's your sleep, it's your drive, it's your energy, it's your men who go into testosterone sound. They say, I feel like my mind opened up. They say they're more productive in business. I have clients who come back and say, man, in the past 6 months, I am more productive. I generated more revenue And the only thing that's different, you put me on testosterone therapy.
Right.
So men go through that. Perimenopausal women go through that as well, right? They have decreased libido, decreased sex drive, vaginal dryness, difficulty achieving orgasm, hot
Tired
flash,
as
tired,
shit.
fatigued, anxiety.
Can't sleep.
Can't sleep. And certain women say, I want to kill my husband when I'm not honest, right? They're just irritable.
Oh.
Yeah.
I don't want to get killed.
Wow.
So,
I'll tell you, I'm tired.
Brain fog.
Brain fog, that's right.
Brain fog.
I have the brain fog.
But you're dumb. That's totally.
That's natural.
That's totally different.
No, I'm serious. I'm tired a lot, and I don't sleep well.
Get your testosterone checked. You might be low on testosterone. Just because you have muscles and your brawn and stuff like that doesn't mean you have a lot of
that's
testosterone.
That's an excellent point, right? Our normal levels of testosterone, unfortunately, neither you nor I had a test when we were younger.
Right.
You're much taller than me. You're bigger than me. So your regular levels of testosterone, your normal levels, probably much higher than mine.
Right.
I'm short. I'm a little guy. So your levels are, at certain age, they start dropping.
Right.
And you are feeling those effects. So when we check the blood levels, and there's no replacement, this is prescription product, this is a controlled product. So you have to be evaluated, you have to get the lab work done. We have a number of different treatment options. We have creams, we have injectables. For women, we actually do something called pellet therapy.
I did the pellet therapy a few years ago. It did work. And then unfortunately, the place that did my pellet therapy kind of veered into a different specialty and stopped doing the pellet. And then I just gave up. But
we do offer pellets in Doylestown and Allentown and Bethlehem.
It works.
Yep.
I would like to come back tomorrow at 9 a.m.
You're on.
So basically, Joe, what they do with these pellets is you go and get your lab work done,
right.
and whatever you're deficient in, they make you like a custom pellet, and they just inject it into your butt.
And it's slowly.
It's like a teeny little incision.
It's a little tiny little
teeny incision.
Tiny little pills. They're formulated specifically for you, and you get them placed either in the hip or the butt area, and they gradually dissolve. Interestingly, for women, they last anywhere from 3 to 4 months.
Yes.
Men are much luckier. They will last about 6 months.
Why is that?
The dose is much higher, and everyone metabolizes them differently.
Yeah, I think it's a Mars and Venus thing.
So, but also most people don't think that women need testosterone.
We do.
You do.
And progesterone. We need it all.
You need it all, but you need to balance the hormones. But most people think we're talking about testosterone. They think about the male, fertility drug. They think about the erection. But women need it just as much. It's much of a sex drive drug for them. They just need a much, much, much lower dose.
Yes.
We're talking about, let's say, testosterone replacement for a male in a pellet will be 2,000 micrograms. For a female, it will be, let's say, 125.
It's all a balancing act. And it's hard unless you have the right doctor to help balance you.
So regular blood work, and this is still it's not a surgical procedure, but it's still an incision. So it has to be done on experienced hands. But when you do it properly, you don't have a scar.
No, they just put one of those little
poke.
teasy tapes on you and you're done.
So question for you. How often should somebody like myself or Loretta get their blood work done?
Well, we're talking about hormonal levels.
Correct.
About twice a year.
Twice a year, that's
Twice a year. If you're on the hormonal replacement, it can be more frequently. Typically, when we do the pellet therapy, we check your levels about 6 weeks after. And then once you finish the cycle, and if you're stable, we may let you go without blood work for anywhere from 3 to 6 months.
Okay.
If you're stable on it. If you start noticing changes, you need a boost, you may need it done more frequently.
And for testosterone?
Well, that's what we're talking about, the sex hormones, testosterone, estrogen, progesterone.
So for women, for men, same thing, twice a year?
Twice a year, yeah.
Okay. All right.
You would probably benefit from it.
I think I would. I think I need to.
Because as you're getting older, I mean, a lot of your fatigue, it's probably because you're lacking in testosterone.
We talked about this before. I work out every day for the most part, at least 5 days a week, sometimes even 6. I don't sleep well. That's my main thing is I go to bed at 10, 11 o'clock, and around 4 in the morning, I'm tossing and turning. Now, most recently, I think you gave me something, you can tell what it's called.
I think it was Regenerative and CTC.
Yes. And you said that would help me sleep. So I've been not taking consistently. Well, that's my issue.
Non-compliant patient.
Yeah.
Well, see, and that's the thing. And what I've noticed most men do is you guys have this thing where as soon as you feel better, you don't need to do
Correct.
Right? Women at least have more staying power when it comes to.
So what is that called? Goga?
well, no, I think the one that you're talking about, the 5 nights a week.
Correct.
The CJC 1295/epamorelin.
So what is the purpose of that?
All right. So that was one of the products we're talking about, building your butt back up. So that's a growth hormone releasing peptide.
Okay.
So that's another whole different, now we're talking about peptides.
Okay. So that's
which is different.
segue into
Which is
peptides.
different, right? First, we talked about hormones.
Okay.
So both tirzepatide and semaglutide are peptides as well.
Okay.
So peptide, it's a fancy term for a certain length of the molecule.
Mm-hmm.
Molecules are made out of amino acids, which are building blocks in life, right?
Okay.
So another peptide is insulin.
Okay.
Insulin is a peptide. So all it is, it's a fancy word for length of the molecule.
Okay.
Right. So, but there's a whole group of peptides which are used for a number of different things. A lot of them are not available in the United States, unfortunately. Mm-hmm. Some are. And one of the peptides that we're talking about, like sermorelin, tesamorelin, the CGC 1295, epamorelin, they're growth hormone peptide. Okay. So the main difference when we're talking about testosterone replacement therapy, whether we're doing pellets in the buttock or injections, in the butt or the shoulder for men, a lot of men prefer injection therapy, but twice a week. That's still a hormone, right? So, and the way human body works, it works in something called negative feedback loop, right? So that's important to understand. Let's say use testosterone as an example. Mm-hmm. Testosterone is produced in the testes, right? In your gonads.
Okay.
And when you inject yourself with testosterone and your body senses levels being high, your testes say, well, I can chill out. I can put my feet up. And I don't need to produce any testosterone because there's so much testosterone floating in my system.
Right.
I don't need to work. And that's why, doing testosterone replacement therapy under physician supervision is so important, so you don't get shrinkage of the testes or suppress your own production completely. Uh-huh. And that's why some of the guys back in the day who used to use gray market testosterone, now bioidentical testosterone, are bald because of the side effects, and now are on testosterone for life. Not that there's anything wrong with it, but they're not on it by choice because they're producing
zero.
Mm-hmm. Because they shut down their own production, doing crap without monitoring. So what are these growth hormone peptides? It's not growth hormone. It's a peptide that tells your brain, specifically a little gland in your brain called the pituitary that sits at the base of the brain, to produce growth hormone. Mm-hmm. Why is growth hormone important? I'm going to digress for a minute because I'm a geek. I'm a geek at heart. I love doing continuing medical education classes for fun. When I go on vacation, I haven't read a book probably in over 10 years. And I'm not proud of it that I haven't read a book besides all the shows on Netflix to catch up on. I take continuing medical education classes, mm-hmm. and not just in my specialty. I don't do it just for pain, for weight loss. I literally go through PubMed or all these medical CME websites. Oh, that's pretty cool. Let me
read up on this.
Let me read up on it, and then I'll take a test, see how much I know.
Right.
I have hundreds and hundreds of hours of completely unnecessary classes. Mm-hmm. So the reason I brought that up, there was a study published a couple of years ago by a very smart doctor, much smarter than I am, Dr. Gregory Fahey out of UCLA, on it's called a TRIM trial, thymosin rejuvenation insulin mitigation strategy. Okay. So thymus is a small gland that lives in the throat, mm-hmm. At the base right here, like behind the heart, next to your thyroid, and it's huge when you're born. And as you get older, it shrinks and goes away, right? So they used 3 products in this trial. They used metformin, which is a good old cheap diabetic drug. They used growth hormone, and they used DHEA, which is, let's say, similar to testosterone. It's a hormone product. And the idea was to boost your growth hormone levels, but boosting your growth hormone can elevate your sugars. Also, taking the growth hormone itself can carry a lot of side effects. You have to be a lot more careful. That's why they were given metformin, and they were given this DHEA. And what they found, the study was very small. It was a pilot study. It was only men. I think it was about 12 people. They found after 1 year of following them, their biologic age actually went back anywhere from 1 year, so they stayed at 0, right? Or actually went back. They became younger when their biologic age. And this is another rabbit hole where we'll do that next, following the conversation about the growth hormone peptides. I'm just trying to explain the difference, right? So this growth hormone, it decreases with age. Mm-hmm. And production of growth hormone starts decreasing really in your late 20s, early 30s. And it goes down anywhere from 15 to 20% per decade of life. Tick, 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 tick. So what does growth hormone do, right? It helps you grow when you're young, but it also helps you with your collagen production. It helps you with healing, helps you with healthy hair, healthy nails, healthy everything else, right?
Right.
Lean muscle mass. I know we have a lot of younger obese folks now, but their growth hormone levels are also lower. So when we're doing these growth hormone peptides, we're not dosing these patients actual growth hormone. We're giving them a peptide that tells their brain to produce growth hormone. So it kicks it back to your 18-year-old self. And you really cannot OD on this, right? Because you can OD on the regular growth hormone if you start injecting too much and then you suppress your own production. And that's why you also do it 5 days a week. And you give your pituitary rest 2 days a week.
Okay.
So you kickstart
like wax
your own
on, wax
production.
off. Yeah.
Exactly.
Uh-huh.
Well, I love your references.
Thank you, Rocco.
You gonna switch?
I think towards the end we're gonna.
We should have switched. We should.
So growth hormone peptide, it's a slower acting drug, right?
Okay.
It's not the CJC. Not going to see results on day one, and the results are slow. You will see improved sleep, but you have to be consistent.
Right.
You will see improved collagen. You will see better hair and nails. You will see leaner muscle mass. You will see better recovery, and hopefully decreased adiposity, decreased fat. It's not a weight loss drug per se, but it's great in combination with medications like semaglutide and tirzepatide if you are working out.
Right.
If you're not working out, I'm not going to give it to my patient. Because what's the point?
What's the point?
Right. You also, what I like about it as well, that you're supposed to dose it at night, last thing before you go to sleep on an empty stomach, because it can elevate your sugars. And it's not going to be as effective when you have heavy carbs in your stomach. So it keeps you honest.
Okay.
Right? Stops you from snacking.
Right.
Because most of us are good during daytime, right? At least some of us are good during daytime. Some not by choice. I hear it from my patients. I'm so busy during daytime.
Yeah.
I don't have time to snack. I get home.
I'm ravenous.
I'm ravenous, exactly. Or I'm laying down in bed to watch TV, catch up on Netflix, and snack. So this keeps you like, hey, I just made level. You need to I need to have an empty stomach for an hour and a half to 2 hours, and I can eat anything afterwards. But what it does, it tells your body to produce growth hormone.
Makes sense.
And it helps you put on that muscle mass. It's not going to help you grow Kim Kardashian type of rear, but it will certainly help.
Yeah, I mean, I do have to say that's the one thing that
you're missing.
That's the one thing that I was like, come back, But
and this is called again what?
CJC 1295, ipamorelin, sermorelin. There's a number of different ones. But again, it's about a 3 months course. Typically, you can do it for a 3 to 6 month, and you have to take some time off. But I don't give it to my patients who do not work out. I love dosing it at what we call a stack in combination
with the working out, because
with working out as well as with the semaglutide, because it helps you put on the lean muscle, and it works on this what we call this intra-abdominal fat. Most people worry about the fat on their arms, fat on their thighs, but the fat that kills is the fat inside surrounding your organs. Yeah, that's the important fat.
It's something. Yeah,
that's the part that we want to talk about. And again, going back to the TRIM trial, the reason I brought that up, in combination with other products, we're actually able to reverse your age. So I'm not doing this just for vanity, not just to look good, not just to be attractive and happy, which is certainly an important part, but we're able to monitor your age.
So speaking of that, and this is the segue I was talking about, we were talking about this a little while back. So there is a test you're telling me about, right, that you can take that will tell you in reality how old you really are. Yes. Correct? And can you tell us more about that?
Oh, I would love
Phenomenal. It's absolutely, it's mind blowing. Yeah. So the test is specifically that we work, the science is called epigenetics. It's a relatively new field, but basically you can do drop of blood. And there's some different tests. There's different local biologic clocks. But one of the most accurate tests is from the company called True Age. And it's a few drops of blood that you send out to the lab. And it gives you essentially 3 results. One, let's say biologically, well, I'm almost 52, right? I'll be 52 in August. So that's my biologic age.
Right.
Right? I'm 51 3/4. And it gives you my chronologic age based on my genetics. Based on the genes in my body, how old I would be, right? So it could be 51 plus 3, You could be, exactly almost, 51 and 3/4, or I could be blessed with great genetics. And both of my grandmothers died. I think one died at 100, the other one died in the late 80s. So good old age, no significant diseases. Do have Alzheimer's in my family, unfortunately. So
I do, yeah.
But I wasn't blessed with the longevity gene. And when I tested myself, my genetic age was +4. Mm-hmm. So I was very upset. But based on my interventions, I think I was -7 or 8.
Oh, I got to do
time.
this.
And it also tests your rate of aging. So it tells you, so I am aging 0.9 years for every year. Mm-hmm. 10% doesn't sound like a lot, but it is. Because your risk of mortality-related diseases goes down more than linear. So you're able to test that. So that's marker that you can lay your hands on, right?
So once we get that, say for example, we drew the triple blood test, get my results, I'm 45, it says in reality you're 48, hypothetically speaking. I want to somehow alter that. Is there a way to change your diet, change anything about the way you live your everyday, or that's irrelevant? It's all genetic based.
Well, no, we're able to modify those things. That's where we're able to do the test. I mean, listen, if you're just taking this and you're now I'm going to age, it's like you have no incentive to do anything.
Correct.
You're able to, obviously, your drinking, your diet. These are the low, easy picking fruits. Changes that you can make.
Sure.
The rest are supplements. Mm-hmm. Whether it's supplements you buy from Amazon, whether it's supplements you get from your physician's office. And the main difference, and I'm not saying everything sold in Amazon is bad. I'm a consumer, right? Just like you. I go to Costco. Well, I don't go to Costco, but personally, I have a spouse that does. I hate shopping. You couldn't drag me in there.
I hate Costco.
But, I still shop on Amazon and I have the same availability of products as anybody else. Mm-hmm. So the main difference between products that are medical grade and products that are generally sold is the bioavailability. Mm-hmm. It's not even what you believe in the label. So let's say you're buying vitamin D and K2, right? Everybody needs vitamin D.
Right.
Or vitamin B12. And it's not even if the label or the product says 1,000 milligrams. It's how much of the product will be absorbed. That's the main difference. The absorption. Yeah. How bioavailable it is.
Like I take the magnesium, but I have to buy the magnesium so I could take it with the K.
Right. So it's combining the product. So it is absorbed.
That absorbs more to do the K. It's like a whole thing.
It's a whole science in itself. So it's not just, some of them are easy supplements, like it's B12, vitamin D, because we're all deficient because we live in the Northeast, but it's also some of the other supplements. There's a number of different supplements. And there's other products like NAD+, nicotinamide adenine dinucleotide. And I know, say it 10 times, Joe. Really fast.
You can say it for me.
All right, I'll say it for you. So there's a number of other things that you can do, including the growth hormone peptides, or even metformin. Metformin has been used as an anti-aging drug. Metformin is cheap. And we can talk about, now we're going to go down a really deep rabbit hole. Drugs like rapamycin is available. Rapamycin is an anti-rejection drug.
Which does?
Well, it was originally developed as for kidney rejection, for transplants. But it's been shown really promising data in different dosage, much lower dosage, for anti-aging trials. And just for your viewers and your listeners, this is purely for educational purposes. Yeah. Always,
don't go injecting
any
this
information
stuff
here is purely for informational purposes. Always check with your physician or check with us. We'll be more than glad to have you tested. Don't go, injecting yourself or buying up all those products on the internet without physician supervision. So there's a number of things that you can do when you get that test. Mm-hmm. A number of different markers and actually suggestions what you can do, both prescription through your healthcare provider, as well as over-the-counter products that you can take to help you reverse that age. And you have to follow through with it. Whether you're able to, do it in 6 months or a year, that's up to you. But everything starts with a lifestyle modification. Mm-hmm. If you want to be lazy, effort and just sit on the couch and take 27 supplements, you can. Yeah. But it's, you're missing the most important component. So that test is incredible that it gives you the actual point of reference.
And this test is called again?
True aging clocks. There's a number of them. The company that I specifically use, it's called epigenetic test. I use a true age test that we offer through our office, and then we have consultation.
What is the whole time frame? Like I come to your office, or you do it at home? How does it work?
Do it at home.
You do it at home.
We send you the kit, little finger prick.
And you send it in. It's like a 23andMe. You send it in.
and you get the full breakdown, and then you schedule one of our providers time to go over the results. Or if you're lucky enough, you get me to go over the results. You're the
maybe
VIP,
we should,
so you would get me.
Maybe we should film this.
That'd be fun.
Okay. Maybe that's
if you're willing to share the results.
I'd share my results. Shit, you can film me putting a pellet in my ass. I'm quite okay. I'm quite okay with that.
Okay, now we're gonna switch right now. I was telling Loretta before we got here, like I know you for many years, but I couldn't tell you other than pain management and obviously in recent years the peptides, what you really do. And I bet where you went to school and how long you went to school when you came to America. So I learned a lot about you today. Anything that you think we've missed?
Well, I'm pretty well versed.
Well, you're pretty well versed.
Well, I think there's two other things that I'll probably cover. I will probably cover one with other peptides, BPC 157.
Which does?
It's a body protective compound. It's a healing peptide, which is, I'm trying to, there's so many different peptides. Probably one of the most commonly used in my practice. It's used for healing.
Okay.
There's two different forms. There's an injectable form and there's an oral form. Most of the peptides, the way that they are, they're not stable. So they have to be injected, unfortunately. Right? BPC is one of the few that we're actually able to take a pill. It was developed, interesting.
So healing, like what do you mean? Like healing from ailments, healing from surgery, healing?
Good point. So healing from muscle tears.
Okay.
Healing from BPC is not just muscle tears. Apparently it helps you also improve your mood, which I'm not sure how well that works, but it's primarily for healing musculoskeletal injuries.
Okay.
It brings fresh blood flow. So it's available in 3 formulations: little injections that you do near the site of injury, whether it's your elbow is hurting you, your shoulder's hurting you, your Achilles or back pain, you could do it that way. It's great for GI problems, ulcerative colitis, leaky gut, indigestion, like heartburn.
Okay.
And that's where you take the pills. Or it's available as a cream. And honestly, for cream, it works. It doesn't work so great for injuries that are like deep tears. You really need to do oral systemic pill or little injection. But we found out it works great for aesthetic purposes, because what it does, it causes something called neovascularization, brings fresh blood vessels, fresh blood flow. So what does fresh blood flow do? It brings new epithelium, new cells. It improves cells turnover. So when you improve cell turnover, you regenerate new skin. So it works pretty well for acne. And just patients use it on their, like as a facial cream. I think it works a whole lot better than it does it as an anti-inflammatory cream.
Okay.
Is there an age that you recommend this? I mean, under what age they should not take it? Or is it for anyone?
It's 18 and up typically. I don't treat little.
No, you said acne. I'm saying for teenagers that have acne issues.
For teens who don't want to go on Accutane, and we have a number of teens who do not.
Well,
want
if
to
you don't have to go on Accutane, why go on Accutane if there's something?
There's other options.
Yeah.
And this is, acne is a whole different conversation. I'm not a dermatologist.
You mentioned acne, so I figured if they can take it, why not?
Yeah.
So maybe next time we get together at Novik in Doylestown.
For sure.
And we can discuss more about peptides and therapy and rejuvenation and
maybe
pellets and
maybe we can do Loretta's pellets live.
Yeah.
You can, I don't mind. I mean, it's been probably 2 years since I had a pellet, so I'm like fresh.
And then we can talk about other options, like some of the machines that they have for skin rejuvenation.
Yeah.
But that would be totally different conversations.
So that's
we have
not
somebody in the Novik team there.
So maybe that's what we do. Maybe the next time we get together, we do it at Novik, and we can get some questions answered and watch Loretta have a pellet inserted in her.
And you need blood. I bet you your testosterone level is.
So maybe I'll do my testosterone.
Maybe we can do some IVs.
Okay.
Love IVs.
So let's get that on the calendar. I really appreciate you coming out.
Yeah.
I learned a lot
Thank
today.
you.
All right.
It was awesome. I had a good time.
Thanks so much,
Loretta.
Oh.
Always a pleasure.
Thank you, Loretta. Well, thank you all for joining us at another episode of the Boom Room Unfiltered. This
has been my favorite one.
Best one yet, right?
Sorry, Roman.
So Dr.
I was
Levinstein.
Romans was my favorite episode. And he kept
Until
going.
now.
He brought up a good point about, what to expect from the, boom. I'm like, what about a boom boom? Just like a double boom.
Well, we're going to go to Miami for the boom boom. Well, again, thank you very much. Appreciate you guys joining us. Stay tuned for the next Boom Room Unfiltered. We will be releasing the guests' information very soon.
Bye-bye.
Bye.